Okay, so I'm just going to get started. So thanks very much for coming to join us today. My name is Stephanie Tom. I am the lead of the Safe Staffing programme, and my colleague Helen Honoré is here as well. We want to thank you for agreeing to be here today to support the work of the Safe Staffing programme. The programme was commissioned by the Scottish Government to support care services, relevant stakeholders and the Care Inspectorate for the introduction of new legislation, the Health and Care Staffing Scotland Act 2019. Our team is quite small, although we are in the process of recruiting safe staffing advisors and a business support colleague. For more information on the programme, we would recommend using the Safe Staffing Hub, and we'll put that link in the chat. The Safe Staffing programme's vision is to ensure that in care services in Scotland, there are the right people in the right place with the right skills at the right time, working to ensure people experience the best health and care outcomes. Our values are the same as the Care Inspectorate's values: person-centred, respectful, efficient, fair, integrity and equality. We're going to do a wee icebreaker now. So we're going to ask you some questions, and the answer to each question is one of the buttons that you will find at the top of your Teams screen where it says react. This is just for fun, so don't be shy and have a go. First question: what organ in the body pumps your blood around? Oh, hearts are coming through. Look at that. That is correct, the heart. What do people do at events to show they like it? Clapping. Yes, lovely. Lots of clapping there. Fantastic. Fantastic. Answer. Oh, sorry, that's me going to read out the answer there. What film? Oh no, I'll do the next one. When you find something funny, what do you do? Yes, you laugh. Lovely. Number 4. What is the international sign for OK? Thumbs up, that's great. And lastly, people either love them or hate them. Surprises. Perfect. Perfect.
Okay,
well,
so Steph, I see a few hands are up. I'm wondering if there's, they don't have the option to choose anything. The react buttons are just at the top of the screen, and they are in the black bar at the top. There's a little smiley face that says react. They're up there, but if you're on your phone, sometimes you might not have access to them, so sorry about that. But don't worry, they're not essential.
They're not essential. It was just for a little bit of fun at the beginning to get people interacting with us, because as we said, you know, we have to have our mics and screens off for this, just to make sure that we can try and get everybody's broadband good. But if you don't have the reaction buttons, you can always use the chat function. But that was just a wee quiz just in terms of the reaction buttons, just to get everybody kind of interested in what we were going to say next. So we want to cover the implementation of the Health and Care Staffing Scotland Act today, and the icebreaker was just a way for you to get ready for some of the session slides, and you can feel free to use the buttons throughout the presentation. And obviously, as I said earlier, you can use the chat function if you don't actually have access to the buttons. We understand this is a very important subject, and many of you will be worried about what this means for you and your service. Because of this, we have tried to make the session informative and at times interactive. We believe that you already have real-life examples of how you meet the requirements of the new legislation, and hopefully by the end of this session, you will have those examples to hand, as well as ways in which you can further develop your own systems and processes to meet the requirements of the Health and Care Staffing Scotland Act. We wanted to start by talking about the realities facing social care as a sector. We know there are things happening currently that are affecting all services across Scotland. There were changes to inspection with a focus on IPC. We know that things you would normally do as standard had to go on the sidelines for a time, and many services tell us they have been slowly introducing things like outings, meetings and staff training. We are very aware of how tough recruitment and retention continues to be, and that staff morale is suffering as a consequence of all of this. We know you have been working hard to try and get things back to normal, and we really appreciate your dedication. Now we're going to move on to our next part of our interactive part of the sessions. So this is a QR code for everybody to get into our AHA slides. Our AHA slides are going to be part of the next part of the presentation, and these are going to be interactive where you can write in your answers. You can use this QR code, and if you can't get the QR code, I'm just going to put the I've also got a link which I'll put in the chat for you right now.
I've just done that, Steph.
Oh, Helen's done it for me. There we go. Fantastic. So we have a few people answering on the slides already. Is anyone struggling to get in, or is everybody okay? You have the link in the chat and you have the QR code as a separate one. You can do it on your phone with the QR code if you use the photo, the camera function, or you could use your computer and use the link. Or if you're on your phone currently, you can also use the link to go directly into a web page on your phone. Is everybody okay?
Did you get the link? Oh.
Is there anybody with any issues? Everybody okay? All right, so at the moment, we've got a slide there which is saying, are you ready for the Health and Care Staffing Scotland Act's implementation in April 2024? Lots of people answering. We've got about 70% that are not sure at the moment, and we hope to have that a little bit lower at the end of this session. We've got about 3% which are not ready, 15% which are somewhat ready, and 10% which are completely ready. And we're really hoping that by the end of this presentation, you'll have a little bit more information and maybe feel a little bit more ready. But that's great that everybody's participating in that poll at the moment. So at the moment, as I said, we're about 10% completely ready, 14% somewhat ready, 71% not sure, and just under 3% not ready. But that's great. I'm now going to hand over to Helen, and she's going to take you through some of the next slides.
Thanks, Steph. So I think there's still some people coming in. For those who are joining us, if you please just turn off your camera and mute your microphone just to help us with the bandwidth, because there's a lot of people on the call. So I'm going to tell you about the Health and Care Staffing Scotland Act 2019, and we're going to tell you about the first part of the Act, which tells us about the guiding principles. These apply to all social care services, and subsection 1A states that the main purposes of staffing for health and care services are to provide safe and high quality services and to ensure the best care outcomes for people who use services. The rest of the Act is all about making these main purposes happen. So there's some questions in the chat about will we get the slides? We are recording the session, so you'll have access to the recording. So the guiding principles continue. and in subsection 1B there are 8 headings that must be considered when arranging staffing in any service type. Over the next few slides, we're going to look at each one in turn, and this is the part of the presentation that we would love for you to take part in. So after each slide, we'll ask for some examples of what you're currently doing, and we'd appreciate it if you would put your thoughts and experiences on the AHA slides or in the chat if you can't access the slides, and use the react buttons if you like. The first of the guiding principles that we must consider when arranging staffing is improving standards and outcomes for people. We already work to the health and social care standards, which lay out clearly what a person should expect from their service provider. So this means you'll already be thinking about improvements and outcomes for the people you currently support. When I'm using the word people, like the Act uses service users, but we like to be a wee bit more friendly. But when I say people, I'm talking about all people and including children. I don't want to have to just go through all the different groups. Sorry, someone just muted me. So people refer to everybody, all ages. So can I ask you to please go to the AHA slide for improving standards and outcomes for people? And we'd like you to tell us what you're doing now or have maybe done in the past around staffing for this topic. So please remember to protect confidentiality and not name any people that you support. So are you all able to get into the AHA slides? I can see there's quite a few people in there already. So thorough recruiting process, absolutely. Ensuring everyone is included, discuss expectations. Yep, absolutely. Yeah, including people and importantly, acting on what they're saying. Wow, there's lots coming in now. This is fantastic. Fair recruitment, absolutely. Enhanced inductions. Allowing people to have a say in who we hire. Yep, absolutely. Putting well-being at the centre for staff and service users. Monthly individual meetings. Yep. Gosh, there's loads of comments coming in. I think we've got 3 pages already. Just fantastic. Yep, continually asking for feedback from our staff team. Oh. Looking at skills of staff, sports hobbies when recruiting for our young people. Yeah, I know there's the matching guidance for your children and young people that's very important that isn't used in the adult sector. So recruiting highly qualified and experienced professional practitioners. Yep, absolutely. Steph, is there anything that's sticking out for yourself? Gosh, we're up to 6 pages.
Sorry, I'm doing the comments in the chat. I'm just going to get the QR code again and get that for some people in the chat. Just one wee second.
No problem. Yeah, so I think some examples that we had thought of as well is maybe adding in extra shifts in order to cover certain parts of the day that have, for example, more accidents and incidents, or to cover children's meals. Changing the key worker of a person or child based on their feedback, needs and wishes, or your observations. Or is there anyone maybe supporting volunteers and matching them with a person living in a service to spend time meaningfully together? Yeah, there's someone's looking at relationships. What skills and knowledge the team have? What do children need? Who can connect and provide safe boundaries? That's really important, isn't it? Wow, this is amazing. Does anyone want to come off mic and speak to what you've written? Anyone brave enough to come and have a wee chat?
Hello, can I just ask a quick question?
Yeah.
Will the answers that everyone's been popping in here also be shared as part of the presentation?
Yeah, I think we could do something around that. Now, it might take us a little bit of time because there's lots and lots coming in, but I think what we could do is maybe either theme them or just put them out. We'll go through them and yeah, we will share.
Thank you.
Okay. Okay, let's move on to the next slide. Thank you so much for your contribution. That's amazing. So the second part we must consider when arranging staffing is taking account of people's particular needs, abilities, characteristics and circumstances. So if you think about this in terms of risk assessment and personal planning, all services except fostering and adoption services will already do this in line with Regulation 5 Part 1, and fostering and adoption services will work to Regulation 5 Part 3. As you already collect this information for each individual and use this to inform support packages, we thought that you may already have examples of where you use this information to inform the staffing in your services. So if we just move on to the next AHA slides and give me some examples, please, of taking account of people's particular needs, abilities, characteristics and circumstances. So what about if maybe a person is only willing to be seen by a female carer? You maybe would aim to support this as much as possible, but do a risk assessment in the eventuality that there were only male carers available and have a contingency plan in place.
Some good ones coming through now, Helen.
Yeah, so children whose first language is not English. Yeah, so maybe you have interpreters coming in, or
someone using an induction loop to support the use of hearing aids.
Fab. It's very slowly moving, this. Having contingency plan in place for searches being carried out on young people who identify as a different gender. Well, that's great. Families complete all about me forms prior to joining service alongside a personal plan and review the personal plans regularly. That's fab. Excuse me looking to the side. I've got 2 screens and this is this is how I'm working it. Oh, I love that. So recognising and respecting staff's individual styles of learning and provide them with training in line with their needs, make culture visible and respectful in the setting by offering meals, celebration. That's lovely. Again, if anyone wants to put their mic on and talk through anything, you're more than welcome. Lisa, did you want to say something? No. Maybe doesn't realise the mic's on. Okie dokie. So someone uses a one-page profile that advises what someone is looking for and ask employees to complete a similar pro forma and try to match based on this. Fab. Great, let's move on to the next one then. So the third principle we must consider when arranging staffing is respecting the dignity and rights of people. So the Health and Social Care Standards 1.1 states, I am accepted and valued, whatever my needs, ability, gender, age, faith, mental health status, race, background or sexual orientation. And 1.2 says, my human rights are protected and promoted and I experience no discrimination. So on the AHA slide, can you please give examples of how you respect people's dignity and rights, and remembering not to name anyone? So I think there was examples before from maybe people from a non-British culture and making sure that they have food, for example, appropriate to their culture. Or how do you arrange staffing to reduce the incidence of physical restraint and secure children's services? Do you listen out for and protect individuals from hurtful comments? What policies maybe are in place around respecting dignity and rights? And we're getting loads coming in again. Ask before doing. I love that. Absolutely. Don't come at someone with a surprise. Tell them what you're doing, or ask them if it's okay. Providing private spaces to pray and good staff rest areas. Yeah, it's really important, isn't it, that people can feel like they get some downtime and some solitary time if that's required. Yeah, people's right to refuse support and interference from organisations. Having clear policies in place that staff are aware of, maybe about food and nutrition, being gender friendly, inclusion, and that staff are well trained. So how do you make sure that staff see the policies? How do you know that staff are aware of the policies? Being discreet, if there are any toileting issues. Getting to know the person really well, listen carefully and respond. Yep. Training for staff on inclusion and equality, yeah, that's really important nowadays. It's always been important, but it's thankfully much more highlighted now with the Equality Act of 2010 in place. And of course, there's people maybe have one protected characteristic, but there's intersectionality where, you know, just because someone has one protected characteristic doesn't mean to say that they don't have another one. So it's really looking at the person as a whole, isn't it? Yeah. Yeah, always remember we support people in their home, not our workplace. Absolutely. It's a good way to look at it. So these are all fantastic, the comments that are coming in. There's loads, and I'm going to look forward to digesting them later. Okay, so let's move on then to the next AHA slide. So the fourth part we must consider when arranging staffing is taking account of the views of people and staff. So again, as I'm talking, have a think about any examples you have around how you gather and act on the views of people experiencing care and staff. In the Health and Social Care Standards 2.11, it states, my views will always be sought and my choices respected, including when I have reduced capacity to fully make my own decisions. And in the SSSC Codes of Practice, it states 2.3, Have systems in place to listen to and consider feedback from people who use services, carers and other relevant people to shape and improve services and the performance of social service workers. 2.4 says have systems in place for social service workers to report inadequate resources or difficulties which might have a negative effect on the delivery of care, and work with social service workers and relevant authorities to tackle such problems. So you're already working within these frameworks. And you guys are great because there's just tons of examples coming in. This is fantastic. You're a really good group to work with. Sometimes people can be a wee bit shy, but this is fabulous. So regular staff meetings to get feedback from staff and listen to any worries or concerns they may have, absolutely. Sometimes management, it can feel that management maybe are a bit removed, you know, so it's really important to get the people who are doing the on the ground work and making sure everybody's voice is heard. Gather the views of children in floor books. Yep, I've heard about those. My background is an adult here, but I've heard ELC colleagues talking about floor books. We've got 4 pages of this. SurveyMonkey questionnaires. Yep, it's a quick and easy way, isn't it, of getting views. Mind mapping with children and staff. Fantastic. Engagement sessions, so a recent springtime event, suggestion board, staff engagement checks. Ooh, that sounds interesting. I'd love to hear more about that. Okay, thank you so much. Let's move on to the next AHA slide. So the 5th part we must consider when arranging staffing is ensuring the well-being of staff. We may see this as an addition to our current legislation and frameworks. However, the SSSC Codes of Practice state in 3.5 to provide effective regular supervision to social service workers to support them to develop and improve through reflective practice. So providing supportive supervision and reflective even practice sessions meets the needs of the SSSC Codes of Practice, but can also provide staff a safe place to discuss their well-being. There's also many online supports that providers and organisations can promote to help staff increase their well-being, such as the free resources from the Scottish Government Wellbeing Hub, from Mind or from the Red Cross, and there's lots of others. If anyone's using any good resources, could we add them to the AHA slide for ensuring the well-being of staff so we can share them with everyone? So in general, there's always exceptions, but in general, happy staff tend to stay in the service. And this is important as people will be offered more consistent care by staff who know them well. So how do you know if your staff are happy at work? What procedures are in place for staff to have their voice heard? Are there any examples of staff feeling they've been listened to? What did that look like? Oh, using the Wellbeing Hub as part of the staff meeting. That's a creative one. A wellbeing station for all staff to access with management support. Oh, I want to come out and see all this stuff. This sounds really great. Monthly supervision and weekly team meetings. And there's an Early Years Scotland Wellbeing Hub. Fantastic. I'll check that out. Yeah, employee assistance programs as well, yep. Yeah, I think this is an area where more can be done across Scotland, someone has said. Yep, and I think, so this staff wellbeing is coming into primary legislation for the first time, and it's certainly going to highlight how important it is. And I think, you know, the current staffing crisis as well has maybe highlighted the how important wellbeing is as well, you know, with so many people leaving the sector. Daily team tune-ins. Celebrate success and achievements. I love that. Absolutely. No matter how small, even really important to celebrate the small successes. Wellbeing chats every 6 weeks with all staff and they set the agenda. That's great. Oh, someone's currently developing a staff wellbeing policy. Oh, well done you. Particularly around menopause, as this affects our general well-being. Yes, I'm well aware of that. I'm at that age. Yeah, these are fantastic. I could just sit and read them, but I better get on. So let's move on to the next slide. So the sixth part we must consider when arranging staffing is being open with people and staff about decisions on staffing. So within the SSSE codes of conduct and the health and social care standards, it says that open and transparent communication with both people experiencing care and staff is expected of providers. Many providers will communicate regularly with both the people they support and their staff teams. However, in the context of staffing and being open and honest about decisions taking, can you give examples or thoughts in the AHA slide? So, for example, do you publish reports that include information on staffing decisions that are available to people and their families? Or maybe this is done informally in conversation or at meetings or on social media. You know, sometimes people ask us, don't they, about what's happening. I see you've got vacancies again, you know, and you can have a bit of a conversation, but do you do that in any sort of more formal way, or do you have a board up if it's a residential facility, or, you know, do you use social media to keep people informed? Yeah, so emails being used. Discuss staff preferences with staff involved. We have a working interview for new staff and we ask the staff opinions. Update families on new members of staff when they start. Yeah, that's really important, isn't it? You know, someone could just turn up and think, who are you? Involve families in the recruitment process. Yep, that's fantastic. So someone's saying this is sadly lacking at present within some local authorities. There's a lack of transparency and respect of existing staff. Yeah. Yeah, I think it's not something that's done as standard in a formal way, is it? You know, maybe have conversations with some people, but we need, I think I agree, we need to get better at saying what's happening. But this legislation is saying that we must do that. So someone's got online platforms where staff can go on and offer suggestions and ideas on how we could do things better. Fantastic. Yeah, it's really important to make things as easy as possible for folk to contribute and have their voice heard. Maybe not stuck to the one time. Keep everyone updated with changes through an app or email, notice boards and a parents forum. Fab. Great. Thanks everyone. We'll just move on. Just conscious of the time. So the seventh part we must consider when arranging staffing is allocating staff efficiently and effectively. So providers will know and understand staff allocation that is effective and efficient will look different depending on various factors such as service size, type, the needs and wishes of people experiencing care. Currently, providers have their own systems and processes to allocate staff to promote people's preferred outcomes and will gather information regarding when more staff are needed and where using a dependency tool to form the base of all of staff allocations. So again on the AHA slide, think about what happens when a staff member is off ill, for example. Are staff reallocated? Or do you use agency staff? What about if a person you're supporting develops increased needs? Previously, they had been allocated maybe one staff member, but now need two. In care at home, for example, are they allocated to different staff who work in a team of two? Or is the existing staff member paired up with another for that person to aid continuity? So how do you deploy staff who are maybe related to one another? Because sometimes that happens within services. The whole family wants to apply, and that might be all right, and in other times it might not be all right. So how do you allocate staff efficiently and effectively? There's lots again coming in. So someone's got deployment grids, take into consideration children's needs at certain times of the day, agency staff, 0-hour staff, buddy, key person, communication logs. Great. I've not heard that term in a while. We have a floater, so if anyone is off, they can cover their duty. So it's someone who's maybe not allocated to anywhere in particular, but they're just going where they're needed. Having champions in several areas, so they're able to support others. Fab. So there's some additional staff in each area, someone's saying, and relief staff employed to provide cover, part-time staff working additional hours when required. Okay, so someone's saying that they don't use agency staff given the client group they work with, and if they couldn't get it covered, then unfortunately would have to send a child home. Yeah. Yeah, someone's saying this is something we struggle with due to staff shortages. I'm absolutely certain you're not alone there. You know, and it's not always been easy. I think that, I mean, there is a crisis in health and social care staffing, but you know, the pandemic made it worse, of course, but I think it's been some years in the making. You know, I was a care home manager for years and I worked in care homes for a long time. I've also worked in the voluntary sector, and just over the years, I've seen it being more and more difficult to recruit people. Yeah, someone's saying, look at if you're a premises-based service, considering the layout of the building, the skill mix. If you're upskilling staff, use a dependency tool and have a bank staff, be aware of their availability. And employing 20% over contract hours to meet the needs of annual leave. Yeah, that's a smart way to do things if you can do it, is to have a wee bit extra to cover for leave and sickness and things. So someone has more than one centre and due to any absences, we have to reallocate staff to ensure the ratios are covered. So if you don't work in early learning and childcare, you maybe not know that they still work to staffing ratios, so that in adult sector doesn't work to staffing ratios. We're going to talk to that a wee bit later on as well. Staffing is so tight that we're constantly fighting fire to try to meet nursery ratios. We really struggle to have enough staff. currently running with many vacant posts across our authority, so this is a real issue for our settings and managers. Yep, absolutely. It's really difficult out there, I really appreciate it. Well, someone trying to have a balance of qualified and trainee staff, that's been very difficult. Okay, all right, that's great. Thank you very much for that. Let's move on to the 8th and last part we must consider when arranging staffing, and that is promoting multidisciplinary services as appropriate. So the Health and Social Care Standards 4.18 states, I benefit from different organisations working together and sharing information about me promptly where appropriate, and I understand how my privacy and confidentiality are respected. So multidisciplinary working takes place throughout the sector on a daily basis. People experiencing care may have several agencies involved alongside a social care service, such as a nominated social worker, maybe an advocacy worker, and a specialist nurse or doctor, or advanced health professional. Multidisciplinary reviews promote partnership working, and personal plans with input from all agencies provide people with robust and clear support. Sorry, Steph, if you'd taken control, I'll just take it back for a wee minute. Just please let us know how you promote multidisciplinary services on the AHA slide. So think about the various professionals you interact with. How do you communicate with them? How do you ask them what they think about the care your service provides? All staff move through all the areas in our after school care, so when staff are absent, anyone can cover an area. So having that flexibility there, it sounds like, really helps. Steph, you're fine to take control now.
Thank you, Helen. Thank you. And thanks everyone. As Helen said, that's been amazing to have so many people give us so many responses. The chat's been going great as well, Helen. Lots of responses in the chat too, which has been fabulous. And you know, a lot of people stating the same thing, which is around the staffing, which we know is a current crisis at this time. So thanks very much for that. We will hope to collate all of this information and get it out to you, but like Helen said, we will need a little bit of time to do that. We do have another session this evening, so we'd like to make sure that we get all the information from that session and then put them together, and we will get that on our hub. So I'm just going to move us on. So you've listened to Helen there, and you've given us all your really good examples of how you're already meeting elements of this new legislation, which is fantastic. And we really want to kind of bust some myths for you here about the Health and Care Staffing Scotland Act. So if you look here, it is a fact that the enactment is in April 2024. It's a myth that all services must use a staffing tool. It's a myth that regulation will dramatically change. And it is a fact that the Act covers all service providers. So I'm hoping that there's no surprises here, and that this, you know, covers what we've kind of said previously in the other slides, and that this does kind of alleviate any fears that people may have in relation to the legislation. The legislation about staffing that is currently in place is Regulation 15. It states that a provider must have regard to the size and nature of the care service, the statement of aims and objectives, and the number of needs of service users. Ensure that all times suitably qualified and competent persons are working in the care service in such numbers as are appropriate for the health, welfare and safety of service users, and ensure that persons employed in the provision of the care service receive training appropriate to the work they are to perform, and suitable assistance, including time off work for the purpose of obtaining further qualifications appropriate to such work. If you look at Regulation 15 and you look at the Health and Care Staffing Scotland Act, the Act identifies that care services have the duty to ensure sorry, I think my computer's just frozen. Oh no, I do apologise. Hang on one little second.
Do you want me to help, Steph?
Yeah, I don't know what's happening. My screen just went very black. Helen, could you?
Okay, I'll just take control, no problem. Okay. Oh, we might have lost her. We'll just carry on regardless. So the Act identifies that care services have the duty to ensure the provision of appropriate staffing. People's care needs should be considered when making decisions about staffing levels and skills mix. Care should be appropriate for the health, well-being and safety of people experiencing care. Staffing should be in the right numbers to ensure the provision of high quality care. Staff must be trained and suitably qualified in their roles, and then there is the well-being of staff. So the similarities are evident. The wording is a little different, but in general, the ask of the new legislation does not differ much from Regulation 15, with the exception of the well-being of staff. There are some differences for care homes for adults, and this is to do with a staffing method, but at this time, these do not impact on the rest of the social care sector, though it is built into the Act that they could do at a future date as the Scottish ministers may specify. So we know that many organisations are great at looking after staff wellbeing. So the Safe Staffing Programme has heard feedback from services that they're not always sure how to measure this. So we worked closely last year with several care homes who were doing small tastes of change about staffing using improvement methodology. Although these were care homes, the work they did is easily transferable to other types of services. So some of these services were creative in how they evidenced staff wellbeing. One service introduced wellbeing questionnaires that staff completed weekly for a limited amount of time. There was a 5-point scale that staff were asked to tick to see how their week had went, and also space for comments. So this gave really useful information and identified areas for improvement. Another service had been having some difficulty retaining new night staff, so they used what they called feedback bubbles with newly recruited staff and used the information to work on small changes to make improvements. You can be as creative as you like. If you have the technology, you could ask staff to choose an emoji to see how their shift or their week went. This can be for a period of time rather than all of the time, because it's a bit of work to collate things like that. So say they do it for a week or a month, then repeat it 3 or 6 months later to see if you've made a difference. So I'd love to hear from services about anything your organisation is doing to monitor staff wellbeing. So I mean, if we'll probably have some really good suggestions in the AHA slide about staff wellbeing, but please feel free to pop this in the chat if anything comes to mind, or you can always get in touch with the Safe Staffing Programme at any time. We're happy to chat. The important thing that services should be aiming for is that it's safe for staff to raise issues without fear of retribution, and that there is a culture of service improvement rather than blaming individuals. Remember, the focus is on staff well-being insofar as it affects the main purposes of providing safe and high-quality services and ensuring the best care outcomes for service users. There is one more thing you need to pay attention to, and that is how many staff do you need to provide your service? So the new legislation does not impose specific staffing levels, and as I said earlier, the staffing ratios that the Care Inspectorate currently recommend for ELC services come from our guidance and not from legislation. So they will not change at this time for ELC services. So when determining what constitutes appropriate staffing levels, care services should consider the nature of the care service, the kind of service they provide, the size of the care service, the aims and objectives they're working to, the number of people experiencing care and the needs of those people. So really probably not much different to what you do now.
We've got a poll in the AHA slides, everybody. And obviously we asked the same question at the beginning, and we would now like to ask the same question at the end. If people could go in and have a wee go at the poll and see where they're feeling now in terms of, are you ready for the Health and Care Staffing Scotland Act's implementation? And obviously we had a few people that weren't ready before. 80%, over 80% now somewhat ready, which is great. 13% completely ready, fantastic. Nobody's saying not ready, which is fabulous. That's great. I'm glad that you've enjoyed the session, and I'm glad that it has maybe alleviated some of those fears. Please get in touch with us if you have any questions. As I said, we're hoping to collate all of the information from the 2 sessions today and then have that on our hub page, as well as a recording of the sessions as well. Thank you so much for joining us today. We've ran way over time, so we do appreciate the fact that you've all stayed and asked so many great questions, and we hope to have all that information out to you. And please do get in touch with us if anything comes up over the next couple of weeks that you think about or you want to discuss further. Please do email us and we'll get back to you as soon as we can. Thank you so much.
There's also an evaluation that I'm just popping in the chat, and we'll maybe send it out because quite a few people have left already. Yeah. If we'll send that out, it's just a quick MS form. Thank you so much to everyone today. Okay, take care. Bye-bye.